The cardiac monitor shrieked, a jagged rhythm as the decorated colonel hurled his breakfast tray across the room and roared at the nursing student to get out of his sight. And when the charge nurse finally sent Joël Mercier down the hall to handle him, he took one look at her and sneered that she was too young and too soft to touch a man who had bled for this country. She said nothing. She simply set down her medication kit, reached up, and pushed back the sleeve of her scrub top, revealing a tattoo that made the colonel's entire body go still. The Foothills Medical Center in Calgary ran on three things: black coffee, controlled chaos, and the unspoken understanding that Ward 9 was not for the faint-hearted. It was the post-surgical trauma wing, the place where patients arrived from the OR still smelling of anesthesia and fear, and where the nursing staff had learned, through years of difficult shifts, that the hardest wounds to treat were never the ones you could see on a scan. Joël Mercier had worked Ward 9 for 6 years. At 31, she was the kind of nurse that newer staff watched when things went sideways, not because she was loud or commanding, but because she was always somehow already doing the right thing before anyone else had registered the problem. She was compact and precise, with dark hair she kept in a low bun at the nape of her neck, and she had a habit of going very quiet when things got very serious. The quiet was not distance, it was focus. On a Tuesday morning in late October, when a damp Alberta cold had settled into the bones of the building itself, Joël arrived at the nursing station to find her colleague Priya standing at the counter looking like she had just survived something. "He threw the breakfast tray," Priya said. Joël looked up from the assignment board. "At the wall," Priya added, pulling at a thread on her sleeve. "Not at me, but close enough," he said, and I'm quoting, "that my hands were too soft to have ever done anything that mattered, and that he wanted someone who actually understood the meaning of discipline." She paused. "He used a few other words too." "Room 918? Joël asked. "Room 918. Joël already knew who was in 918. She had read the chart the night before, at the end of a double shift, standing at the counter with cold coffee because something in the admission notes had made her stop. Colonel Bernard Taschereau, retired, 64 years old, formerly of the 3rd Battalion, Royal 22E Regiment, the Van Deuce, admitted for complications following a hip replacement surgery. A developing deep wound infection that, if not controlled aggressively with intravenous antibiotics, was likely to become a serious systemic problem within 48 hours. He had already refused 2 doses of his prescribed treatment. He had already told 2 nurses and 1 resident physician that he did not take orders from civilians who had never had to make a decision that cost a human life. His chart also noted, in the attending physician's slightly weary handwriting, "Patient presents with significant hypervigilance and acute stress response consistent with history of operational trauma. Recommend sensitivity in approach." Joël had read that line twice. She drew up the medication herself, a fresh bag of IV antibiotics and a saline flush, and walked down the long corridor toward 918 without hurrying. The floor was pale linoleum the color of old snow. The fluorescent lights buzzed faintly overhead. Through the narrow window beside 918's door, she could see him. He was sitting up in bed with the rigid, punishing posture of a man who refused to allow his body to admit defeat. He was large, still. Broad through the shoulders, even now his white hair cut sharp at the sides. His face was angular and weathered, the kind of face that had spent years in conditions that were not gentle. One hand rested on the bed rail. His jaw was set. He was staring at the wall. She pushed the door open without knocking. "I told the last one to send someone useful," Taschereau said without looking at her. His voice was gravel on ice. "Are you useful? I'm the nurse assigned to your care today," Joël said. She stepped past the upturned breakfast remnants on the floor without looking at them and set her medication kit on the bedside table. "My name is Mercier. I'll be starting your IV antibiotics." He turned his head then and looked at her the way men like him looked at people they had already assessed and filed away. His eyes were dark and sharp, still fully functional as instruments of command, even in a hospital bed. "You're a child," he said. "I'm 31, she replied, snapping on gloves. "I was in charge of 240 men at 31, he said. "Kandahar, you want to talk to me about responsibility at 31? He leaned forward slightly, and the movement cost him. She could see the flash of pain cross his face before discipline locked it away again. "I've been in this ward for 3 days. 3 days, and not one person in this building has treated me like someone who has actually seen the world. They treat me like a child. They use soft voices and bring me pudding and ask me if I'm comfortable. I am not comfortable. I am furious. There is a difference." "I know there's a difference," Joël said. "Do you?" he said. It was not a question. "Your right arm, please. I need to access the IV site." He pulled away from her. It was a small movement, but it was definitive. "I am not letting you push more chemicals into my body based on the recommendation of a physician who has never had to think clearly while someone was shooting at him. You people have no understanding of what a body can actually withstand. You see a number on a screen and you panic. I've operated on 4 hours of sleep for 11 days with a fractured rib. I think I can manage a hip infection." "You can't," Joël said, directly but without sharpness. "The infection is in the bone, Colonel. That's not a metric we're flexible on. If the bacteria reach your bloodstream, you're looking at septic shock. And at that point, we are in a very different conversation about your survival." She looked at him steadily. "I'm not asking you to trust me personally. I'm asking you to understand the biology." Something crossed his face. Irritation, and underneath it, a deeper and older kind of anger that had nothing to do with her. "Get someone else," he said, turning his face away. "Send me someone who has earned the right to stand in this room. Send me a military doctor, or a veteran nurse, or someone who has at least once in their life had to make a decision under conditions that were not comfortable and well-lit and fully staffed. I don't want to be touched by someone who learned everything she knows in a classroom." Joël was quiet for a moment. She set down the saline flush. In that quiet, the monitor beeped its steady rhythm, and somewhere down the hall, a cartwheel squeaked against the linoleum, and Taschereau's jaw tightened in a way that told her the pain in his hip was worse than he would ever acknowledge out loud. "I'll come back in an hour," she said. "I want you to take that hour, Colonel, but when I return, you are going to let me start that medication." She picked up her kit. "If you need anything before then, use the call button. I'll answer it." She walked out. In the corridor, she leaned her back against the wall for exactly 5 seconds, eyes closed. Down the hall, the ward moved around her. The quiet shuffle of a patient being walked, the distant murmur of a family consultation. She breathed out slowly. She knew what lived underneath that kind of anger. She had seen it before, in a different context, in a different country, in a different version of herself. She pushed off the wall and went back to work. By early afternoon, the duty physician, Dr. Farouk, had reviewed Taschereau's latest blood work and found what Joël had been watching for, the early markers of systemic spread. He came to find her at the medication station. He's going to need a central line if he keeps refusing the peripheral IV, Farouk said quietly. The site is compromised anyway. He pulled it last night. We're running out of access options and out of time. I know, Joël said. He won't let anyone near him. I know that too. Farouk looked at her with the particular expression of a physician who respected the nurses on his ward enough to not pretend he could solve a problem they were better equipped to handle. Whatever you're going to do, he said, do it soon. Joël walked back to the 918. She did not hesitate at the door this time. She pushed it open and entered with her full kit, and she could see immediately that the hour had not been kind to him. His skin had taken on a grayish undertone beneath the weathering. His breathing was slightly faster than it should have been. The sharp posture was still there, but it was costing him more now, visibly. The way holding a door open against a strong wind costs more and more the longer you hold it. He saw her come in, and his face hardened. I said, get someone else. I heard you the first time, she said, setting her kit down. And I've decided not to. You don't have that authority, he said, his voice dropping into the low, controlled register of a man accustomed to having his tone alone settle arguments. You are a nurse. I am. You're a patient, she said. In my ward. She pulled on fresh gloves. And your fever is at 39.4 and climbing. I can see from the door that you're tachycardic, so I'm going to ask you to stop performing for me and let me do my job. His face flushed with a sudden surge of fury. Performing, he repeated, and the word came out like something he might spit on a parade ground. You think this is a performance, you soft, overschooled. You have no idea, no concept of what it means to have actually. He stopped. His hands gripped the bed rail, and for a moment, something underneath the anger broke through the surface. You want to talk about pain? He said, his voice shifting register, going rougher, going somewhere older. You people, in your clean wards with your protocols and your charted milligrams, you've never had to look at someone and know that what you do in the next 30 seconds is the entire difference. You've never had to make that call. You've never carried it afterward. He was staring past her now. Corporal Adebayo, he said very quietly. Private Lachance, Sergeant Trott. He said the names the way you say names at a cenotaph, each one a full stop. Panjwai District, 2009. I sent them to secure a compound. I had the satellite imagery reviewed. I had 2 intelligence assessments, and I gave the order. His voice was barely above a murmur now. They were inside for 4 minutes before the secondary device went off, and I stood at the radio, and I heard it, and I knew. The room was very still. So don't, he said, his eyes finally coming back to Joël's. Tell me about pressure. Don't stand there with your clean hands and tell me anything about carrying weight. Joël did not move. She looked at him for a long moment, at the fever in his face and the grief behind it, at the rigid posture that was a form of penance as much as habit, and she made a decision. She set down the IV tubing. She walked to the door and latched it shut with a quiet click. She went to the window and drew the privacy blind, dimming the room to a soft, low light. Then she turned back toward him, and she reached up to the collar of her scrub top and unpinned her hospital ID, setting it on the table beside her kit. Taschereau's eyes tracked all of this with the alertness of a man whose instincts had never fully stood down. What are you doing? He said. I need you to look at something, Joël said. She pushed her left sleeve up above the elbow. On the inside of her left forearm was a tattoo. It was not decorative. It was the kind of ink that gets put on by someone in a forward operating base with rudimentary equipment and absolute certainty. dark lines, clean but rough at the edges, clearly old. A caduceus, the winged staff and twin serpents of the medical field, but rendered in a specifically military way, the staff crossed with the maple leaf of the Canadian forces. Beneath it, in small, stark lettering, Task Force Kandahar, Roll 3 MMU, and below that, a date range, 2008-2009. Taschereau stopped breathing. His eyes moved from the tattoo to her face and back to the tattoo. "I was a combat medic," Joelle said. Her voice was different now, not cold, not clinical, but stripped down, carrying something real. Deployed to Kandahar Airfield. I spent 14 months with the Roll 3 multinational medical unit. We got the casualties from all the forward elements. She took a step closer to the bed. The Van Dues came through us. His hand had loosened on the bed rail. "Corporal Adebayo," she said. "He came in by Chinook on a Wednesday afternoon. I was the medic on the trauma bay when they brought him off the helo." She paused. "He was conscious. He was talking. He asked me if his guys were okay, and I told him we were working on them, and I needed him to focus on his breathing." She held his gaze steadily. "He made it through surgery. He was in Germany within 72 hours. Taschereau made a sound, barely audible. The involuntary sound of air leaving a body that has been holding tension in its chest for a long time. "I didn't know that," he said. "Most of it was above your clearance level," she said quietly. "The medevac reports, the surgical outcomes, they didn't filter back to unit commanders in the field unless there was a specific reason. You gave an order, and then the Army took over what happened afterward, and you never got the rest of the story." "Private Lachance," he said. Joelle was quiet for a moment, and the quiet told him something before the words did. "Lachance didn't make it," she said. "You already knew that." She watched him nod, very slightly, the motion barely visible. "But what isn't in any report you've ever read, and I know this because it was classified as operationally sensitive until 2 years ago, is what the intelligence assessment found after the fact." She moved to the chair beside his bed and sat down, bringing herself to his level. "The compound your men were sent to secure was being used as a storage point for components. IED components, enough to build 11 devices. When that secondary charge went off, it destroyed the stockpile. Not what your men triggered, what the detonation chain destroyed in the room behind it." She leaned forward slightly. "The insurgent cell that had been operating in that district lost 11 months of material in 20 seconds. The engineers who assessed it afterward estimated that stockpile would have been used in a coordinated attack on the Route Summit convoy the following week. 43 personnel, armored vehicles but not armored against that quantity of explosive." Taschereau was staring at her. "Lachance didn't die because you made a mistake," Joelle said. "Your intelligence was accurate. Your order was sound. What your men walked into was a storage facility that was booby-trapped specifically to prevent seizure of the materials. They went in and they did their jobs, and the secondary device destroyed 11 months of enemy operational capacity." She held his gaze. "Your men saved those 43 people on Route Summit. That's what actually happened. That's the complete story." The sound that came from Colonel Bernard Taschereau was not what she had expected. It was not the clean break of grief, the kind that happens fast and loud. It was slower than that, a long, shaking exhale, and then a silence. And then his face changed in a way that faces change when something that has been held rigid for a very long time is finally allowed to let go. His eyes, still sharp, still dark, filled slowly. 14 years, he said. "I know," she said. 14 years I've been. He stopped, started again. I've seen LeChance's father twice since then, at regimental functions. I couldn't. He pressed his mouth into a line. I could never look at him directly. You can now, Joelle said. She said it gently, but without softening it into something smaller than it was. He looked at her for a long time. Then he looked at her forearm, where the sleeve had fallen back down over the tattoo. You were there, he said, not a question anymore. I was there, she said. I left the forces at 31 and went back to school for my nursing degree. I've been here for 6 years. She stood up. And right now, Colonel, I need to place a central line in your subclavian vein so that we can get a therapeutic dose of antibiotics into your bloodstream before your temperature hits 40. And we're having a much more complicated night. She met his eyes. I've placed central lines in a level 2 trauma bay in Kandahar at 2 in the morning, with a generator failing and incoming on the wire. I think I can manage the conditions in 918. Something shifted in his face, a recognition, and underneath it, something close to relief. He lay back against the pillow. He turned his head so his chin was up, the left side of his neck and chest exposed to her in the way that indicated he had done this before, that he knew what the access position looked like. Allez-y, medic, he said quietly. Go ahead. She worked with the steady, unhurried precision of someone for whom this was familiar territory. He held entirely still, the stillness of a man accustomed to keeping his body obedient under conditions far worse than this. When the guide wire threaded and she secured the line and taped it flat and connected the antibiotic drip, she stepped back and stripped her gloves and pressed 2 fingers briefly to his radial pulse. Checking. Good, she said. How long, he asked, for the antibiotics to clear the infection? Minimum 10 days of IV, then oral for another 3 to 4 weeks. She began clearing the sterile field, but your fever should start dropping by tomorrow morning if this dose takes hold. He was quiet for a moment. The nurses this morning, he said, the young one, and the one before her. Yes, I was. He stopped. That was not acceptable. What I said to them. No, she agreed. It wasn't. He looked at the ceiling. I'll speak to them. I think that would mean something to them, she said. She gathered her equipment and moved toward the door, and she was almost through it when he spoke again. Mercier, he said. She turned. He was still looking at the ceiling, but there was something different about it now. A looseness in his face that hadn't been there when she arrived. In 14 years, he said carefully, this is the first time I've told anyone what happened out there, what I thought happened. He paused. I didn't think anyone still knew. I knew, she said. He nodded, very slowly, just once. She left him there in the dim room with the antibiotic drip running steady, and she walked back down the long corridor to the nursing station, and she sat down for the first time all shift. Priya appeared beside her with a cup of coffee and set it on the counter without saying anything, the way good colleagues do. Joelle wrapped both hands around it. Her hands were steady. They were always steady at work. She had learned that in Kandahar, in the trauma bay, in the long months of doing difficult things in difficult conditions with people whose lives depended on steadiness. She had also learned something else, in that same place, in the same months, that the wounds that don't show up on any scan are often the ones that do the most damage, and that healing them doesn't look like anything in the protocol manuals. Over the following 10 days, Ward 9 became a different room than it had been in the weeks before. Taschereau's fever broke by Thursday morning. His infection markers improved daily, his white cell count moving steadily back toward normal. He was cooperative with every member of the nursing staff, Not warmly at first, because warmth did not come naturally to him, and he did not pretend otherwise, but correctly, carefully, with a formality that the nurses recognized as his version of respect. On the second morning, he asked Priya her name. He used it correctly for the rest of the admission. On the fourth day, he asked Joelle during a vitals check if she had found civilian nursing to be a difficult transition from military medicine. Different, she said. Not easier. No, he said. I imagine not. On the eighth day, Dr. Farouk came in for rounds and found Taschereau sitting up with reading glasses on, reviewing what appeared to be his own lab results, which someone had printed at his request. Farouk looked at Joelle. Joelle looked at the ceiling. His hemoglobin is trending in the right direction, Taschereau said, without looking up. And I've been reading about biofilm formation in chronic osteomyelitis. I have some questions about long-term prophylaxis. Yes, Farouk said. Absolutely. On the morning of discharge, Joelle arrived for her shift to find a message at the nursing station asking her to come down to the main entrance when she had a moment. She finished her first medication round and made her way down. The lobby of the foothills was a wide, light-filled space, and in the middle of it, near the main doors, Colonel Taschereau was seated in a wheelchair in civilian clothes, a dark jacket, a Van Deuce tie pin that caught the October light through the glass. Waiting with a patience she suspected was a recent development, but he was not alone. There were 7 people standing behind him. She recognized the bearing before she recognized the faces. 3 men, 1 woman, a younger man on forearm crutches, an older one who moved with the careful deliberateness of someone navigating nerve damage in his left side. Civilians in dress, all of them, but not civilians. She knew that posture. She had lived among it for 14 months. One of them she knew by face. A woman named Fortier, who had come through the Roll 3 trauma bay in 2009 with shrapnel in her shoulder, who had been awake and swearing fluently in Quebecois when they removed it. Fortier caught Joelle's eye and gave a small, unmistakable nod. The lobby had gone quiet in the particular way that spaces go quiet when something is happening that people instinctively understand to be significant. Taschereau looked up at her from the wheelchair. "My regiment takes care of its own," he said, his voice carrying clearly in the still lobby. "I was reminded recently that the definition of who belongs to us is perhaps wider than I had understood." He reached into the inside pocket of his jacket and withdrew a small envelope, holding it out to her. "This is a personal matter, not a formal gesture." She took the envelope. Inside was a photograph, old, the color slightly washed out, the kind taken on military-issue disposable cameras in the early 2000s. It showed a group of soldiers outside a sand-colored building, squinting into desert sunlight. Someone had circled one face in the back row in ballpoint pen. She looked up. "That's Lachance," Taschereau said. "I thought you should have a copy, so you know who you saved." She looked at the photograph for a long time. Behind Taschereau, the woman Fortier said something quiet to the man on crutches, and he straightened. And then, without a spoken signal, all 7 of them came to attention. Not a formal parade ground movement, but the real thing, the kind that comes from the body, remembering what the body was trained to do. And they saluted her, not her rank. She had no rank anymore, her. Joelle stood in the middle of the hospital lobby, in her navy scrubs, with her hair in its low practical bun, and the photograph of a young soldier in her hand, and she felt something move through her chest that she did not have a clinical name for. She raised her right hand and returned the salute. The bonds that form in the worst places don't dissolve when you come home. They go quiet, sometimes buried under years and ordinary life, and the effort of learning how to exist in a world that does not understand what you saw. But they don't disappear, and sometimes, in a hospital ward in Calgary on a gray October morning, they surface and remind you that you were never as alone as the long years made you feel.